Hi, my name's Dr. John Alchemy with RateFast. Today I'm going to be talking to you about impairment report anatomy and applications. Today I'm going to talk specifically about history and activities of daily living. In impairment ratings, it's imperative that you get a reasonable and a good, thorough history for the impairment rating because there are several things in that history that go directly to the impairment rating, and I wanted to discuss a few of those today. Most importantly, and probably most commonly, is the pain score. So the doctor will often ask the patient, what's your pain level? Then the patient will typically give you a number between 0 and 10. Now, what the doctor may or may not know is that those numbers between 0 and 10 have very specific values in the AMA guides that are referable to activities of daily living. Because pain and activities of daily living are closely connected, as are symptoms and activity of daily living. So when we say pain, we're often thinking like someone with back pain, and then that pain is on a scale of 0 to 10. However, if you're doing something like asthma, obviously there's no pain involved, but there's shortness of breath. So it's very important that the doctor be able to understand and make that translation between the 0 and 10 when they're talking about pain, but also when they're talking about things that don't involve pain but are limiting function for the patient, such as the asthma, like I said. So can you walk 2 blocks? Can you go up 3 flights of steps? Are you dependent on your medications? All of those things. Now, getting back to that pain score, which we're all familiar with, the score traditionally is between 0 and 10, but what a lot of people don't understand is that the AMA guides has different pain scores back in chapter 18 that actually link the ADL function up in that table 1-2 on page 4. So those two chapters are closely linked. And so when you're asking about pain, you're really asking someone about their activities of daily living. And as we know that the whole point of the AMA guides is to generate something called a whole person impairment value. However, what that whole person impairment value really is it's a reflection of activities of daily living loss, which is really what impairment is about. So, for instance, if I ask a patient and they tell me that their pain is 10 out of 10, if I'm going to accept that and put that into the report for everyone to read and base my conclusions, my ratings on that, all of this, that means that the patient is bedridden. And usually that's not the case when you're in the exam room with the individual and they've come and walked in on their own and so forth. So it's really important that a 10 out of 10 pain, if a doctor is going to put that down, that means this person is really dependent on others for all of their activities of daily living. That includes like taking a bath, getting dressed, and having someone feed you. We don't see that very often in the clinic, but I'm just using that as an extreme example. The more common distinction that needs to be made is between a pain of 3 and a pain of 5. Now, a pain of 3 is a mild pain, and according to the AMA guides, that means you can still do everything for yourself, but you have some discomfort. It doesn't slow down the activity, it doesn't stop the endurance, but the patient is aware of it. Now, when you make that transition from a 3 to a 5, when you're a doctor putting down a 5, now you're telling the stakeholders that there is pain and or symptoms that limit function. And what I mean by that is activities of daily living really need to be thought of in 2 ways. One is pain only or symptoms only, and the second one is limitations with or without symptoms. And so when you're asking questions about pain, and you're crossing over into the 5, it means that you're starting to have limitations of function. And again, that could mean that it's pain limiting your function or some other symptom like shortness of breath with asthma, as I mentioned before. And basically what this means is you're having your symptoms enough that they're slowing down one of 2 things. Either they're slowing down the rate at which you can do something or the endurance at which you can do something. So let me just use another example. If I have back pain and before I could walk 3 miles an hour for 2 hours, and that's my pre-injury baseline. Now I'm hurt, okay, but I can still walk 2 hours, but I can only walk at a speed of 2 miles per hour. So my rate has slowed down. Now, flip that around. If I'm walking 3 miles per hour, and I used to be able to go for 2 hours, now I can only go for 1 hour. Now I have some limitation in my endurance. So those are really the 2 key things that a lot of doctors miss and a lot of stakeholders don't understand. And because activities of daily living and pain are so closely tied and so imperative to the rating, it's really important you have a firm understanding of this going into understanding impairment ratings and the applications of impairment ratings. So just to be clear, on our 0 to 10 pain scale, if you read or see a 3 out of 10 pain score, it means the patient has pain, but they can do everything fine. There's basically no limitation. If you see a number that's 5, it's basically telling you that the patient and the doctor have decided that there is some limitation either in rate or endurance, and the symptoms are now affecting activities of daily living. If you get up into the 7 and 8, now you're saying to yourself, we not only have limitations, but there are some major or substantial revisions or help that the patient needs to do their activities of daily living. And then the 10 out of 10 score, that's pretty rare. I mean, it can happen, but a 10 out of 10 score means that this individual is totally dependent on others for nearly all of their activities of daily living. And I'm talking everything. So think about someone who's maybe paralyzed in bed, or someone who has a condition that makes them spend most of their time in bed and really can't do any of the things for themselves. This includes driving, dressing, toileting themselves, preparing food, all of these things that you'll find in the table 1-2 on page 4 of the AMA guides. So again, this is step 1 in learning about impairment report anatomy, interpreting signs and symptoms, and the applications for the impairment rating. And as you'll see later in our series, that the number and the pain score is foundational in how you're setting up the justification for your value and how the calculations will take place that will form the final impairment rating. I hope this has been helpful. And again, this today was discussing impairment report anatomy and applications, history and activities of daily living, understanding and applying those terms.